Financial problems cause depression more commonly than the loss of a loved one. Working in a stressful environment causes depression more frequently than financial problems. There are many modifiable steps we can take to avoid depression, which is why we will discuss the top 7 hidden causes of depression. Depression is when a person feels persistent sadness or emptiness. They lose interest or pleasure in activities they once enjoyed, a condition called anhedonia. They also experience a lack of energy and constant tiredness even after minimal effort, which is called fatigue. Depression is persistent, pervasive, and affects all aspects of life, both personal and work-related. However, not all feelings of sadness are depression. For example, sadness after a loss is grief and it fluctuates. A person may feel sad but still experience moments of happiness. If a person is exhausted at work, it is called burnout, which is not depression, but eventually, if left unresolved, it can cause depression. Depression lasts at least 2 weeks and impacts daily functioning, while sadness, grief, and burnout are typically situation-specific or shorter in duration. The first and most common cause of depression is genetics. Almost 40% of depression cases have a genetic basis. If a person's parent has depression, they have approximately a 5-fold increased risk of developing depression compared to the general population. When we mention genetics, we refer to the body's predisposition to synthesize less serotonin, which is a key neurotransmitter in the brain. This imbalance can lead to mood instability and make someone more prone to depression. Sometimes a person is genetically predisposed to be more reactive to stress, which affects brain function and increases the likelihood of depression. The second most common cause of depression is chronic stress at work. Long hours, high pressure, and unstable industries lead to chronically elevated levels of cortisol in the body, which is the main stress hormone. Cortisol causes shrinkage of the hippocampus, which is critical for memory and mood regulation. Chronic cortisol exposure leads to neuron atrophy and reduces neurogenesis, the formation of new neurons. This impairs emotional regulation and is a key factor in depression. Cortisol also affects the prefrontal cortex in the brain, which is crucial for decision-making, impulse control, and emotional regulation. The amygdala, responsible for emotions such as fear and stress, becomes hyperactive, which is why depression frequently coexists with anxiety. Also, cortisol directly lowers serotonin levels by impairing the production of tryptophan hydroxylase, the enzyme responsible for synthesizing serotonin. Financial problems are the third most common cause of depression. People facing unemployment, economic downturns, or high debts experience chronic, long-term stress and increased cortisol levels. The fourth most common cause is relationship problems, especially conflicts in marriage, with family members, or emotional abuse. These situations also increase chronic stress and are directly linked to depression and anxiety. The fifth most common cause is health-related problems, particularly chronic illnesses such as diabetes, cancer, or chronic pain. Ongoing physical health issues create significant emotional stress and lower individuals' resilience to mental disorders. The sixth is caregiver burden, which is an important risk factor. It refers to when a person faces high emotional and physical demands over long periods, leading to burnout and chronic stress, especially for caregivers without adequate support. The seventh is traumatic life events, such as bereavement, for example, the loss of a spouse or other family member. Abuse, particularly childhood physical abuse or growing up in environments of physical violence, causes long-term psychological scars, increasing the risk of depression. Accidents, such as car accidents or natural disasters, can also cause strong emotional and psychological trauma, increasing the risk of depression. One of the strongest inverse correlations exists between physical activity and depression. More specifically, manual labor or physical work significantly decreases depression. This is particularly evident in populations living in rural areas, or those engaged in physical occupations. Physical work and exercise have several important influences on our body. Physical exercise increases the production of endorphins, which are the body's natural mood boosters. Also, enhance the levels of serotonin and dopamine, neurotransmitters crucial for well-being. Physical activity improves sleep quality, which also decreases cortisol levels. It reduces inflammation and oxidative stress, both of which are linked to depression. Meta-analyses consistently show that people who regularly engage in moderate to vigorous physical activity have around a 30% lower risk of depression. The first-line treatment for depression, if it is mild to moderate, is psychotherapy, which is considered the mainstay. For example, cognitive behavioral therapy focuses on identifying negative thoughts and replacing them with healthy ones, which helps change emotions in a positive direction. Meditation also helps significantly because it reduces rumination, a key feature of depression where a person repeatedly focuses on negative thoughts. Meditation techniques, especially mindfulness-based practices, help calm the mind, reduce stress, and improve emotional regulation by reducing overactivity in brain regions like the amygdala, which is linked to fear and stress. If non-pharmacological treatment is not enough, and depression is more severe, then the first-line treatment is antidepressants, such as selective serotonin reuptake inhibitors. Examples include sertraline, also known as Zoloft, fluoxetine, also known as Prozac, and escitalopram, also known as Lexapro. These are usually taken once a day, with a smaller starting dose and a higher maintenance dose. Sertraline is commonly used when depression is combined with obsessive-compulsive disorder or anxiety. Escitalopram is considered a safer choice, while fluoxetine is more commonly prescribed to younger people due to energizing effect. Serotonin and norepinephrine reuptake inhibitors are used when depression is associated with pain, such as in fibromyalgia. From supplements, omega-3, 1 to 2 grams per day of EPA decreases depression symptoms, particularly in mild to moderate depressions. S-adenosine is also considered effective as it increases the production of neurotransmitters and significantly reduces depression symptoms. St. John's wort is effective at 300 milligrams, taken 3 times per day for mild to moderate depression. However, it has many medication interactions, so caution is advised. Vitamin D and magnesium also play some role as adjunctive therapy. Probiotics also play an important role, as the gut-brain axis is crucial in mood regulation. Probiotics like Lactobacillus and Bifidobacterium strains are especially effective when used as an adjunct to standard therapy. In addition, a healthy lifestyle is of great importance, especially physical activity and a balanced diet. For work-related stress, maintaining a work-life balance is important. Set boundaries, take breaks, and avoid overwork. Prioritize tasks and delegate when possible to reduce pressure. Support systems are also important, so seek support from co-workers or mentors if available. For financial problems, counseling and financial planning can help ease stress. For relationship problems, cognitive behavioral therapy and interpersonal therapy are commonly effective. Improving communication is essential. Open and effective communication can help resolve conflicts early. Set boundaries to maintain personal space and time, especially in emotionally draining relationships. For people with significant health problems, techniques like acceptance and commitment therapy can help patients accept the limitations imposed by their illness and reduce psychological suffering. For traumatic events, trauma-focused therapy such as eye movement desensitization and reprocessing and trauma-focused cognitive behavioral therapy are effective.